Okay, good afternoon, doctors, or good morning, doctors, depending on where you are in the country. I'm very, very glad to have you this afternoon or this morning to go over the top 5 questions that insurers may ask about CRMA spinal ligament injury testing. The first thing I want to do is just do a sound check just to make sure someone from my staff just types into the question box, yes, I can hear and see this just fine. Okay, great. That's fantastic. All right, so let me get started. First of all, for those of you that don't know me, my name is Dr. Kronk. I'm the Director of Education for Spinal Kinetics, among other things that I do for Spinal Kinetics. And this is being put on today by Spinal Kinetics. So let's get started with the top 5 questions. First of all, I want to show you a marketing piece that you're going to see. You'll see it in Chiro Econ. And I want to go over just a little bit about it in what you actually see here. First of all, we're the only medical service in the country that can deliver CRMA spinal ligament injury testing to the chiropractic profession. That's what makes Spinal Kinetics unique. You cannot do in your offices what we do at Spinal Kinetics, not even close. So you can't do what we do here at Spinal Kinetics. Precision CRMA takes the guesswork and subjectivity out of spinal ligament injury assessments. So that's what Spinal Kinetics does. It does spinal ligament injury assessments or an intersegmental motion study. And we help doctors take the stress out of personal injury work. That's why you're here today, to learn something to help with that. At Spinal Kinetics, we're a small company that's making a big difference in the spinal injury market. We're making a bigger and bigger difference every single day. And as I'm going to show you, we're about to make a seriously big difference. We're making it a reality that spinal ligament injuries can be accurately assessed and diagnosed in a very systematic way so that these injuries no longer are the #1 cause of pain and disability. We know that the way to the future that produces far better patient results and significantly lesser costs, and we're proud of that. We're proud of the fact that as a company, we're making a huge impact in the spinal ligament assessment market. Now, computerized radiographic mensuration analysis, or CRMA, is the registered trademark of Spinal Kinetics. There's not another group, another software, anything else that can deliver CRMA testing in the country. Only Spinal Kinetics. Now, the reason why we did that is so we could maintain the quality of what we were doing. And we needed to term or describe what we were doing in a trademark term. And that's our trademark term. Anybody that's using it out there right now is using it in violation of a trademark. Now, our board certified medical radiologists have been doing this for a very long time. There's no company in the country that has board certified medical radiologists that have been doing this longer than we have at Spinal Kinetics. And that's part of what makes us unique. Our quality control, our proprietary quality control procedure for report accuracy is second to none. There's nobody and this is why I'm saying you cannot do this in your own clinics because you don't actually have the quality control factors that we do to make sure there's an accuracy factor in the studies. That's the biggest thing you want to do, is you want to work with a company that has extreme quality control for accuracy of your findings. These findings are some of the most significant findings in the spinal injury market. So you want them unbiased and you want them accurate. And you cannot produce that in your own clinic. Now, we have over 13 years of national service experience. That means we've been supporting doctors of chiropractic in the market more than any other group. So we understand what you may not understand or don't understand or what you run into. There's nothing really that we hit in the market anymore that we don't understand. We also have the largest amount of experience with the clinical application of this procedure, which makes us really significant. Our educational free webinars, second to none. There isn't anybody out there that is putting these programs on to educate doctors in this particular field for these particular testing procedures. And we flow a lot of power to the chiropractic profession. Wow. Now, that's what you can do. That's what you can actually do with the information. So that was basically just showing you, and I apologize, I didn't set that up as good as I probably could have. What that was showing you is understanding of what you're doing with CRMA testing makes all the difference in the world. It allows you to diagnose things that most patients can't get diagnosed anywhere else. And it allows you to treat effectively things that now are properly diagnosed in a really efficient and effective manner, which is exactly what the whole market is looking for. And it allows you to document in a way that allows the patient access to any benefits they're entitled to. And it is a significant game changer in the spinal ligament injury market. Now, we as a company also have we're currently servicing 791 doctors across the United States with 10 new doctors last month. We expect 10 or 15, 20 new doctors a month now, month in, month out. And so we have a lot of experience with your questions, with your concerns, with what you understand, what you don't understand. And we're one of the only companies in the country, actually we're the only company where you can get on with somebody like myself. You can set up a consultation call and get all kinds of help getting your questions answered on any questions that you have with spinal ligament injury testing. Look, we as a company, we help take the stress out of personal injury work for chiropractors. Personal injury work can be really stressful. It's really stressful if you try to be a jack of all trades. Then it becomes really stressful. So we take a lot of the stress out of personal injury work. Now, let's get on to what you're here for. The top 5 questions insurers will ask, and let's take a look at that. Number 1, why do you send out for a CRMA? That's one of the questions that doctors get asked the most. Why do you send out for a CRMA? It's a really simple answer: to determine the severity and location of ligament injuries. That's the simple answer. That's what you're doing it for. Now, inherent is a term that means existing in someone or something as a permanent or inseparable element. Inherent in a leg fracture is a displacement on X-ray. The more displaced the bone is, the worse the fracture is. So you can determine the severity and location of a fracture once you understand what is inherent in a fracture. And by the way, this is called an imaging biomarker. Imaging biomarker is something you see on imaging that then indicates that the condition indeed is there. Now, when we look at sprains, spinal sprains are ligament injuries. Inherent in a ligament injury is excessive motion, excessive translation, excessive angulation, excessive translation. These are excessive motion findings. They're inherent. You can't have a sprain without them. Now, you could have a mild sprain that has little abnormal or no abnormal. That's why it's mild. If you have a moderate or severe sprain, you have to have abnormal or what we consider to be rateable excessive motion. They're inherent. Now, doctors across the country are knowing this, and the more that they know it, and the more they're applying this, the larger the patient base that they're serving. So not only did that, what I just showed you with that testimonial, was he talking about, and I'll show you another testimony at the end, are we talking about injury work? We're also talking about non-injury work. The thing that causes chronic pain is the thing that causes, the thing that causes acute pain is the thing that causes chronic pain. So it's inherent. You can't have it without it. So the question was, why do you send out? Well, to determine the severity and location of any ligament injury, right? So if we look at this chart right here, this is a ligament injury. These are grade 3 sprain findings. These top 2 are grade 2 sprain findings. Now, this isn't a webinar on grading the severity and location of a sprain. This is just answering the question. Now, one of the other things that you can do with this testing procedure is you can make a determination about the likelihood of having a disc herniation. So in this study, predictability and severity of disc degeneration and disc protrusions using horizontal displacement of cervical dynamic radiographs, produced in June, sorry, this is not in here, in June of 2018, said that C5 and C6 have the highest sensitivity and the highest specificity for predicting disc protrusion or herniations. Now, what this means is that 93% of the time, if you have excessive motion in the extension radiograph on 5 and 6, 93% of the time you have disc herniation. 100% of the time, if you didn't have it, you don't have disc herniation. So what that is in medical diagnosis, there's a thing called test sensitivity and test specificity. Test sensitivity says it's the ability of the test to correctly identify those with the disease or condition. Test specificity is the ability to test to correctly identify those without the disease. So what that research is saying is, if I have a CRMA study here, C5, excessive motion right here, that means that there's excessive motion between C5 and C6. This is excessive motion between C6 and C7. So always measure the one above to the one below. So it says in that research published in June of this year, that is 93% sensitive for the fact that you've got a disc problem there as well. And it's 100% sensitive, specific, if there was no excessive motion there, it would be 100% specific that you don't have any disc problem there. That's on x-rays, doctor. That's on the test that you use the most as your primary imaging procedure. And that's what we do at Spinal Kinetics. We bring this out. Now, we bring it out so you become more educated consumers, right? So we basically put you at a new level of professional. We put the doctors, our doctors, and we love our doctors. We love doctors that get this. We love doctors that actually want to get to the cause of the condition and not just treat endless symptoms. We love doctors that want to get to the cause, because that's what we help doctors do. And we help do it in a way that nobody else does. We want to increase the professionalism of all the doctors we work with. We don't just work with doctors of chiropractic. We work with doctors of chiropractic, doctors of osteopathy, medical doctors, doctors of PT. We're interested in any doctor that wants to work with the cause of the condition and not just work with the symptoms. Now, second question, what's the validity of this testing procedure? You're going to see this. You're going to be asked this. A super, super simple question. Once you understand, validity is an assessment of the degree to which whatever you're looking at measures what it's supposed to measure. So in this case, we're supposed to measure motion, excessive motion. So back in, this was done in 2011, when we built our proprietary system. We actually put and had, we had built for us artifacts that were 10 millimeters wide. We put them on the x-ray and we measured it at 10.05 with our system. That meant we were 99.999% accurate with our measurements. in our ability for our system to measure what we said we were measuring. Nothing else out there has ever been tested. Ours has been tested. Now, positive predictive value. Let's look at this. The proportion of patients who test positive who actually have the condition. So now I'm going to drop into some research here. And again, this is research that was published in January of 2018. And it's called, we're just going to look at one area of spinal instability, which is the lumbar spine. This is applicable to the cervical spine as well. And here's what it says. It says that dynamic radiology was positive 100% of the time. It doesn't get any better than that. Positive 100% of the time for picking up instability. That's what it's stating here. Now, when you look at, a lot of times insurers want to look at, well, the validity of the testing procedure. And they think that, wow, in their ideas is what is it used for? Well, if you look, these are Blue Cross Blue Shield surgical pre-authorization guidelines. Again, I'm sticking with the low back right now. Flexion extension films for spinal infusion requests based on who are on today, or doctor therapy who may be on today. It says right here, failure to improve after approximately 3 months of conservative therapy for low back pain that emphasizes physical reconditioning should be present in all cases before they actually allow the surgery to occur. Right? So now you can talk about, hey, look, the person may need surgery due to an auto accident or due to a work-related injury. Right? But what this shows is it shows the validity of the results of these testing procedures. Here we have a return to play parameter. Management of return to play parameter for contact sports. Absolute contraindication if these findings are fresh and intact and not stabilized. Third question, and I know I go a little bit fast. I go fast because I'm assuming that most of the providers on our program are pretty educated in this area. Can this information on CRMA be obtained through physical examination? Well, the answer is no. No, it can't be. And that should make total sense. Now, all findings of these excessive motion tests correlate to physical findings in examination. So you correlate the two, and now you've explained precisely to the level why the problem is occurring, and you no longer are treating these symptoms, you are treating these problems that are causing the symptoms. You're getting to the cause of the problem. And the more that you get to the cause of the problem, man, does practice change, because your confidence level of what you're doing goes through the roof. And patients are very attracted to that. I did that for 17 years in private practice. And they're very, very attracted to the confidence level of working with somebody who is not just working with symptoms, who's getting to the cause and can show them very specifically and with great science and great validity what is the cause of their problem. Is CRMA a generally accepted diagnostic test? Well, the answer to that is yes. Again, you can't go to all of these X-ray, dynamic X-ray tests are measurements. So of course it is. This is also for the chiropractic profession. It's in the best practice guidelines. The procedure itself is in the best practice guidelines of the International Chiropractic Association. And it also happens to be in the oldest oldest and most active, and I apologize for this picture. That's an old picture of the book, Vertebral Subluxation in Chiropractic Practice. This is a current active clinical guideline. It's the oldest and most active clinical guidelines in chiropractic. And under that, I get asked at times, well, can a chiropractor adjust these things? Well, here's what it says in the oldest guideline. The American Medical Association, its guides to permanent impairment, lists the following as acceptable means to rate impairment. You're going to see impairment due to loss of motion segment integrity. That means there's greater than 3.5 millimeters of translation of motion or greater than 11 degrees of angular difference amongst the vertebrae. Those are severe. They're grade 3 sprains. Now, what does it say? It says the above are, in fact, components of a vertebral subluxation complex. Now, I don't know, as a doctor of chiropractic who treated vertebral subluxations and spinal instabilities for 17 years of private practice and have been assisting doctors now for 30 years on these procedures, the majority of chiropractors can adjust these and are adjusting these. And if it were the case that you couldn't, if you took a look at this whiplash study right here, what it would be saying is that you cannot treat any of these vertebrae. So of course you're treating them, and of course you have been treating them. The beauty of Spinal Kinetics and what Spinal Kinetics allows when you use us as a service, you're allowing us through our research and through our communications to communicate that this is being done and to communicate that this is the best way it's being done, when a lot of times professions have a hard time unifying their message. We are making that message, and very, very clearly. So, you know, the question of, well, can you adjust a spinal instability? Yes. And why are you adjusting a spinal instability? To stabilize it. And how are you stabilizing it? You bring the mechanoreceptors back online to normalize neuromuscular control. And you're also reducing the inflammatory aspects so that you don't have chronic pain associated with it. Now, this is, again, the oldest active chiropractic guideline in the country. And of course, this right here is nothing more than a component of this. Now, in order to assess this, it's an X-ray finding and then a motor, sensory, or pain problem associated with it. It's what it always has been. Do you have to retest to see if the ligament injury is there at the end of care? The answer is no. No, you don't. Now, why? Well, I'm going to give you an example right here. At C2, you're going to see this fracture right here. That fracture is permanent. The factors around it are not. That is what you were treating, not the fracture. Ligament injuries are permanent. The factors around them are not. The ligament injury itself, once you spring a ligament, once you hyper stretch a ligament, once you go through ligament subfailure or full failure, most of the ligament injuries are subfailure injuries. They're stretched. Once they stretch, they allow excessive motion to occur. That excessive motion, 2, 3, 4, 5 months, 6 months with your treatment, you're still going to see. The only time you're not going to see it is when the degenerative disc disease and the degenerative arthritic changes throughout the whole joint change it to stabilize it naturally over time. So ligament injuries are permanent. You don't have to if you said, well, I'm going to treat this 27 times or 45 times with adjustments, would you expect this to be gone? No, it's permanent. So would you expect the ligament damage to be gone? No, it's permanent. That's not the part you're treating. You're treating the neurological component, and you're treating the motion and the actual mechanoreceptor components around it. That's what you have been doing, and that's what you are doing. Now, again, we help take the stress out of personal injury work for doctors, for chiropractors. And in these programs, they're short. I go very, very short, but that's what we do at Spinal Kinetics. That's what makes us unique. That's why chiropractors like working with us. And especially when you get into a jam, right? So it's very easy to get into jams in personal injury work. You have defense attorneys, you have people who are saying the patient's not injured, you're over-treating, you're not doing the right thing, what you did caused the problem. There's a lot of things that occur in personal injury that stress a lot of doctors out. Well, a simple test can seriously take a tremendous amount of stress out of personal injury work. And remember, when you're using Spinal Kinetics, it's completely unbiased. We don't care what the results are. You can be targeted as you've manipulated the results, or you're somehow not producing correct results. Nobody's looked at your results. There's no quality control with your results. You don't even know how your system works. You don't know how the accuracy of your system is. Once you start doing it yourself, you have to know all of those factors, and you have to be responsible for all of them. Again, you can't be a jack of all trades. Now, a lot of doctors ask me, and I put these in here not to mix the message with Spinal Kinetics, but a lot of doctors don't understand ligament. I completely demystify ligament injuries and really offer you a very broad ability to really flourish in the market. It's called a Smart Injury Doctors Program. And that's where I do a lot of training of doctors. That's where we actually help you to promote the messaging around ligament injury. So this is just an example.
Did you know that back and neck injuries are some of the worst injuries you can get to your body? That's because in one way or another, your lower back and neck are involved with just about every other function in your body. These injuries are the most common physical reason for chronic pain and the inability to work or enjoy the normal activities of daily living. No one wants to spend the rest of their life complaining about their bad back or neck, or spending your life's earnings paying for expensive chronic pain care. If you have injured your back or neck, your first problem is finding a doctor that is good at quickly diagnosing the problem and getting the right care started right away. Your second biggest problem is not delaying getting to that doctor, because time really matters. Every day you wait or you are put on hold can increase your costs dramatically and seriously increase the risk that you will not obtain a full physical recovery. Don't delay and call our office today, as we are part of a group of dedicated smart injury doctors whose primary focus is on back and neck injuries. Call us now.
Now, all that does is obviously these back and neck doctors that are going to be able to diagnose this, what do they use? They use Spinal Kinetics to actually get the excessive motion testing so you can determine the severity and location of a ligament injury, which is exactly what I was just talking about. This is Dr. Kronk. First of all, just let me say, wow. They say you don't know what you don't know, and I didn't realize how much I did not know. I've been a member for 9 months and began seeing a return on my investment almost immediately. Our office started seeing more underrepresented third-party PI claims settle for full billed amounts. Why do they settle for full billed amounts? Because they document, because of how they document. As I continue to learn this information process and working up the PI cases, I'm becoming increasingly confident in our ability to become the PI expert in our area. What I've learned is not only helping with PI cases, but also with health insurance patients and claims as well. What you got here is a complete understanding. Once you understand, when ligament injuries and what is caused by ligament injuries is demystified for you, it opens up a practice that you've never seen before. And one of the things that a lot of doctors do right away is they realize, oh my gosh, there is no scarcity of patients. There are so many patients that actually need this. Now, as a last part of my other company that I have and that I own, we'll be putting out the largest injury website in the country, and we'll need doctors that actually do just exactly what I just said. So when you're working with Spinal Kinetics, you're working with all of that. You're working with the ability to seriously expand and partner in your growth on these ligament injuries. And I'll be putting, those of you that are come to these webinars know that I spend 30 minutes. I go through a topic, I spend 30 minutes, and then we're done. It's very quick and it's very to the point. And then you can ask as many questions as you want to. Now, for those of you that are new, that have never used Spinal Kinetics, you want to use us, you call 877-508-9729. I highly recommend that you do. For those of you that want to go online, you go to www.thespinalkinetics.com and you can put out an information form and somebody from our staff will contact you. We'll contact you and you will be one of our new doctors. Now, we have 2 requests when you come on board, and we will onboard you so that you can properly start to use Spinal Kinetics. But the 2 biggest requests we have is just fill the 3 forms out correctly that we have you fill out with each study, and send us good x-rays. Take good x-rays. And if you're not taking good x-rays, we even have people that can help you with that. But it's just that easy, and it's just that easy to get involved. And the doctors that get involved and stay involved are seeing significant changes in their practices. It opens you up to medical referrals, to attorney referrals, all kinds of things. So biggest thing I wanted to go over, though, was the 5 main questions that we see. It's now time for a question and answer. And if you have a question, all you have to do is type it into the question box, and I will answer your questions. Rateable finding is permanent. Is a permanent injury? Is an abnormal finding also permanent? That's a great question, doctor. Yes, both are permanent. Both, whether it's an abnormal level or it's a rateable level. So it's a grade 2 sprain, or it's a grade 3 sprain, or it's a grade 2 sprain. Those sprain findings, those injury findings, are permanent, totally permanent. Okay. How long have you been doing these procedures? How long have I personally been doing these procedures? Excuse me, since 1996. So since 1996, I've been involved with this procedure. There's nobody in the country that has been involved with this type of testing longer than I have, or has more actual practical clinical experience applying it. So long time now. Thanks for asking the question. I feel old. All right. Okay, good. So how do we get our attorneys to understand this? Well, your attorneys can come on to these webinars just like you can. The biggest thing with your attorneys understanding this is so simple, is your understanding has to be really good of what you're doing and why you're doing it. And the more your understanding is good of what you're doing and why you're doing it, the easier it is to explain to attorneys. And the thing is, my experience with it is, over time, these attorney relationships can be serious relationships. Okay. Oh, I just have a comment from our billing. Let me go back to the bottom. From our billing department that says, please inform the doctors to make sure that the forms are filled out appropriately and that they have all the insurance information, because that way we can get the patient bill paid and the patient to get what they're entitled to. So yes, that is absolutely true. We want you to fill out the forms correctly. Okay. Good. I'm just rolling down here. Oh, what's the best time to do this testing procedure? Another great question, doctor. I'm going to give you an experience. First of all, you have to be the doctor, so ultimately you have to make the decision on when you do it. But my question always back to a doctor that asks that question is, when do you want to know how bad the injury is? How soon do you want to know? You want to know, in my experience, as soon as you can. Because you have to remember, on these ligament injuries, the sooner the patient can get to the right doctor. The whole reason for this Smart Injury Help site will be to direct patients and to educate patients. Look, you can't wait. You can't wait for this procedure anymore, or you can't wait for a doctor that knows. You have to get to a doctor that knows what you're doing with this, because every day matters. In work comp, every day that there's a delay of getting to the right doctor, it's a 3% increase in the claim cost. So I'm just going to give you an example. Okay, at the end of 10 days, if they're not there by work comp study to the right place, we're talking a 30% increase in the claim cost. So the costs are significant for delays. And we're going to be pointing it out more and more. So you got to have doctors that understand exactly what we go over to understand. And that's why sometimes in these half-hour programs, you just can't. You just can't. I can't explain things enough. That's why I have a whole other program that goes over and does explain it, and does have monthly consultations with it for any questions that doctors have. All right, do attorneys approve this test? Yeah, attorneys totally. Great question, doctors. Attorneys totally approve of the test, but you know, you have to understand that one of the reasons why we as a medical company really like supporting doctors of chiropractic is because doctors of chiropractic are not approved of in some respects. So we help to assist with that in establishing the significant role that doctors of chiropractic have in this particular entity, in the treatment of this condition. So we're helping you when attorneys don't respect doctors of chiropractic. We're helping to bring respect to those doctors, and we seriously assist with that. And again, that's where I said, you know, we help doctors of chiropractic take the stress out of personal injury and out of personal injury work. And it's not just personal injury work; it can also be workers' compensation, right? Same injury happens in work comp. You know, if I cut my finger in a car accident, it's called an auto injury. If I cut my finger at work, it's called a work injury, but it's the same injury, right? Spinal ligament injuries are the same whether they occur in a car accident, or they occur at work, or they occur in a slip and fall, or they occur at home, or they occur outside of the home. That's not at work or not in a car. Is it ever too late during a PI case to use your service? No, absolutely not, doctor. A lot of times what you're going to want to, or what occurs is the patient's not totally recovered, 100% recovered, and you want to know why. You're new to this procedure, great. So you have this patient in this phase of care now. All you're doing is sending out to us and stating in the report that you're thinking that, you know, part of the problem with this patient not fully recovering is a ligament injury. You're going to do this testing procedure not only to see what the ligament injury is, but also to assist you with future care recommendations and what you're going to do in the future for this patient to try to minimize their condition. So no, absolutely not. Absolutely not. Okay, so another doctor, when is the best time to send in for CRMA? The best time to send in for CRMA, again, is when you want to know the severity and location of the injury. There's a lot of misinformation out there. And a lot of people will say, oh, geez, they're sprain doctors or they're ligament doctors, and they've never done excessive motion testing. And they don't have hundreds and hundreds and hundreds, 500 cases professionally of, hey, I've referred out for this procedure, and now this is how I've used it clinically. They don't have any experience with it, but yet they're experts in it. And so they will say, well, look, pain and inflammation are going to restrict the range of motion. You have to, you know, shoot them later, do them later. Well, when you have pain and restricted range of motion, you're going to see it's very clear. A patient can't move forward, can't bend backwards. So if they can't bend forward and they can't bend backwards, they can't flex or extend, then yes, you have to do some treatment to get them to be able to at least flex and extend. If the flexion looks like the extension, or if the flexion looks like the neutral and the extension looks like the neutral, yes, you're not going to get a good study. But if they can bend forward and they can bend backward, there's no muscle spasm that's going to keep that vertebra from slipping. So, again, my experience in the market as a treating providers, I send them out right away. So, and you'll recognize when you can't, because the patient will not be able to move. And then you can say, look, pain and inflammation are restricting the patient's ability to flex and extend. Therefore, I can't get an adequate study. Therefore, I need to do treatment. And within 2 to 4 weeks, I'm gonna test for this test for the ligament damage, because I should have the patient to the point where they can flex and extend. Okay, the billing department here is saying, make sure doctors understand that they have to document when they send out for a referral. So you have to document, hey, I'm sending out to determine the severity and location of a ligament injury. And when you get the results back, you have to show how you're using the results. And that has to be in your documentation, or the studies don't get approved. They don't get paid for. So the number one problem that Spinal Kinetics has with getting their studies paid for, and by the way, our studies get paid for whether they get paid by the insurance company or they get paid on a lien. we're like you, we'd prefer to get paid by the insurance rather than holding on a lien. But if there is insurance, the biggest reason why we don't get paid and we have the biggest billing issues is because there's no notes in the doctors saying what they did and why they did it and what they used it, how they used it. So those things you have to put in. And that's easy. The same thing you do with an MRI. I'm sending out for an MRI because I think I have a disc herniation. It comes back negative. Okay, negative disc herniation. I'm not changing or altering my treatment plan. I'm going to stay with it. Oh, positive disc herniation. Good. I'm actually going to do decompression. Now, I'm going to change my treatment schedule. I'm going to increase my treatment schedule. I'm going to reduce it. I'm going to increase the amount of active care that I'm doing. You have to show how you're using the results of the test. All doctors do that. And it shouldn't even be something that doctors have to be even told, but unfortunately we do have to tell doctors to do that because doctors don't document what do they use the test for, and then how did they use it to address a more appropriate treatment plan for the patient. Okay. All right, I don't think I have I'm not seeing any other questions. I'm just rolling up and down. I'm not seeing any other questions. Doctors, I really appreciate your time. Look for us about every 2 weeks. We put out programs every 2 weeks to help you to just take, I'm going to tell you right now, here's what I'm going to tell you right now, especially if you new doctors that have never used Spinal Kinetics, or you doctors that are not currently using Spinal Kinetics, a patient is going to walk into your clinic today or tomorrow, and you're going to wonder what they have and how bad it is. And I'm going to tell you, you no longer have to wonder. All you have to do is act on what you know. Don't just sit on it, act on it. And you'll see the difference in the patient. You'll see the difference in you as a doctor. Okay, so I'm going to let you go for now. I will see you on the next program, and I thank you very, very much for your time today. Always appreciate it. Thank you, doctors.